Hi everyone, welcome to our ECNS live. So, hello दोस्तों. So we are going to discuss about medical surgical nursing in this section. मुझे पता है आप लोग बहुत टेंशन में हैं अपकमिंग एग्जाम्स के बारे में सोचकर, तो डोंट वरी, हम हैं आपके लिए, आपको सपोर्ट करने के लिए, और वी आर हियर टू हेल्प यू विद द एग्जाम्स. सो आज हम लोग डिस्कस करेगा मेडिकल सर्जिकल नर्सिंग 1 और 2 का इम्पोर्टेंट क्वेश्चंस. So, दोस्तों, listen here. This questions will definitely come for next exam. So, मैं आज मेडिकल सर्जिकल का इम्पोर्टेंट क्वेश्चंस आपसे डिस्कस करूंगा. सॉरी. हम लोग आज डिस्कस करेगा मेडिकल सर्जिकल का फर्स्ट और सेकंड पार्ट में. आप लोगों को 2 एग्जाम आएगा, 2 पेपर लिखना है. फर्स्ट मेडिकल सर्जिकल नर्सिंग 1 और बाद में मेडिकल सर्जिकल नर्सिंग 2 का भी एग्जाम्स लिखना है. सो कैसे लिखते हैं, कैसे स्कोर करना है, हम लोग डिस्कस करेगा, और हम लोग बोथ सब्जेक्ट का इंपॉर्टेंट क्वेश्चंस भी आज डिस्कस करेगा. सो ये इंपॉर्टेंट क्वेश्चंस मैंने आज सुना है प्रीवियस ईयर क्वेश्चन पेपर से. प्रीवियस ईयर क्वेश्चन पेपर लेकर उसमें रिपीट हो गया वो क्वेश्चंस चुनकर मैं आज एक लाइव प्रिपेयर किया है आपके लिए स्पेशली. So be alert everyone, we are going to discuss about med-surg first and second the important questions. Yes, sorry for the trouble and inconvenience. हम लोग आज शुरू करते हैं एमएसएन का फर्स्ट क्वेश्चन. सो फर्स्ट क्वेश्चन हम लोग आज डिस्कस करेगा वो है डायबिटिक मेलिटस. आपको पता है ना, डायबिटिस मेलिटस इज इंपॉर्टेंट, 10 मार्क है, लॉन्ग में से क्वेश्चन और शॉर्टर से क्वेश्चन. सो व्हाट इज डायबिटिस मेलिटस, डेफिनेशन देखते हैं. सो डायबिटिस मेलिटस इज अ क्रॉनिक मेटाबॉलिक डिसऑर्डर. एक्सक्यूज मी. सो हम लोग डायबिटिक्स मेलिटस का डेफिनेशन फर्स्ट देखते हैं. सो व्हाट इज द डेफिनेशन? डायबिटिस मेलिटस इज अ क्रॉनिक मेटाबॉलिक डिसऑर्डर. सो और एक मेटाबॉलिक डिसऑर्डर है, एंडोक्राइन सिस्टम में आते हैं. तो कहां पे आते हैं? मेटाबॉलिक डिसऑर्डर इज डिस्कस्ड हियर, एंडोक्राइन डिसऑर्डर. इट्स कैरेक्टराइज्ड बाय हाई ब्लड ग्लूकोज लेवल, हाइपरग्लाइसीमिया. सो ब्लड शुगर, हमारा ब्लड शुगर बढ़ जाते हैं, हाई ब्लड शुगर, और इट इज नोन एज हाइपरग्लाइसीमिया ड्यू टू डिफेक्टिव इंसुलिन सेक्रेशन, इंसुलिन एक्शन, और बोथ. कैसे हो जाते हैं? इंसुलिन सेक्रेशन में कुछ डिफेक्ट हो गया और इंसुलिन सेक्रेट होते हैं बट द बॉडी इज नॉट यूजिंग. इंसुलिन एक्शन नहीं है, और बोथ रीजन से, वजह से क्या हो जाते हैं? ब्लड शुगर ब्लड शुगर इंक्रीज हो जाते हैं. सो दैट कंडीशन इज नोन एज डायबिटिक मेलिटस. सो व्हाट इज द डेफिनेशन हियर? इट्स अ क्रॉनिक मेटाबॉलिक डिसऑर्डर कैरेक्टराइज्ड बाय हाई ब्लड शुगर लेवल्स due to defective insulin secretion, insulin action, or both. Yes. So हम लोग टाइप्स देखते हैं. What are the types? Types इधर 3 टाइप्स है mainly. Type 1, Type 2, gestational diabetes. So क्या है Type 1? Type 1 diabetes is usually it is not without any cause. So इसका cause is unknown है. Without any cause the person may develop Type 1 diabetic mellitus. Coming to Type 2 diabetic mellitus, it is due to a secondary cause. इसके एक रीजन होगा, मे बी पैंक्रियास को थोड़ा डिफेक्ट, इंसुलिन प्रोडक्शन का डिफेक्ट, हार्मोन इनसफिशिएंसी, ऐसे सेकेंड ईयर टाइप 2 में एक सेकेंडरी कोज होगा. सेकेंडरी कोज के वजह से क्या होते हैं? टाइप 2 डायबिटिस मेलिटस. कमिंग टू जेस्टेशनल डायबिटीज, प्रेग्नेंट ladies will develop gestational diabetes. So it will start at the beginning of their pregnancy and it will end, maybe it will mostly the time it will end at the time of delivery of the baby. So that is what called gestational diabetes. So it is type 1, type 2 and gestational diabetes. So these are the main types of diabetes mellitus. So coming to what are the 3P classical symptoms of hyperglycemia or diabetes mellitus. So it is mainly classified as 3P. So what are the 3P here? It is polyuria. What is polyuria? Excessive urination due to osmotic diuresis from high blood glucose level. So when the body is increasing, the blood glucose level is increasing in the body. So क्या हो जाता है? Urinary excessive urination हो जाता है. So that is what called polyuria. So the definition, it is also may arise for a 1 mark question. So what are the three P's here? So what are the 3 P here? First one is polyuria, means excessive urination, increased amount of urination. So the person will have diabetics, means they will go for every time you washroom they will go. So that is what called excessive urination, polyuria. So second P is polydipsia, excessive thirst. So they will feel excessive thirst caused by dehydration from increased urination. So they are going continuously to the washroom, they will have increased urination. So this increased urination will cause increase in thirst. So thirst बढ़ जाते हैं और पूरा का time they will feel thirsty. So the full day they will feel continuously thirsty. And polyphagia, excessive hunger. भूख ज्यादा लगते हैं, डायबिटिक पेशेंट को नॉर्मल इंसान से कंपेयर किया तो भूख ज्यादा लगता है. एक्सेसिव हंगर दे विल फील ड्यू टू द बॉडीज इनएबिलिटी टू यूटिलाइज ग्लूकोज प्रॉपर्ली. दे विल फील every time they will feel hungry. So that is what called polyphagia. So these are the main 3 or classic symptoms of hyperglycemia. So what are the classic symptoms? Polyphagia, polyuria, polydipsia. Yes. So coming to, we are discussing about medication. So medical management of diabetes. कैसे medicine से manage करता है? What are the diabetes mellitus management? First one is oral hypoglycemic drugs for type 2 diabetes mellitus. तो type 2 diabetes mellitus के लिए oral tablets. So tablets इधर क्या है? First category is metformin improves insulin sensitivity. So it will be available in tablets like 500 mg, 1000 mg or different variety of brand names. You will get this tablet, that is metformin. And sulfonylureas, glimepiride and glycoside stimulate insulin release, and DPP4 inhibitors, sitagliptin helps to regulate blood sugar. So these are the main 3 agents used to control or through orally controlling of diabetic mellitus. Yes. So coming to another important medicines, that is insulin therapy. So we all know that the persons who have diabetes, most of them they'll have insulin therapy. It is for type 1 severe, type 2 diabetes mellitus, that is they are having insulin therapy. Two types of therapy, that is short acting insulin and long acting insulin. So insulin therapy also, it depends on the patient condition, the brand name or the medicine insulin they are using, it will differ, but most of the cases of type 1 and severe type 2 diabetes, they will use insulin. So insulin injection also is one of the medication for controlling hyperglycemia or diabetes mellitus. Yes, so what will be the nursing management here? So what are the nursing management? Maybe you can advise the patient to control their blood sugar levels. How to control? The food they are having. So cutting out of sugars, the healthy diets they need to follow, taking the prescribed medications continuously, they need to take the prescribed medication, and follow up also they need to do. About the physical exercises, so due to lack of inactivity, physical inactivity, there is a chance that person will develop a high cholesterol level, that it will particularly lead to hyperglycemia. So what they need to do? Physical exercise, healthy diet, they need to cut out the alcohol as well as smoking habits, and they need to do the follow-ups and regular medication and blood sugar monitoring. So as a nurse, you can tell them about the blood sugar monitoring, and you can do the blood sugar monitoring along with giving the health education. So this is the management of diabetes mellitus. So coming to another important question, that is also from MSN 1, that is pulmonary tuberculosis. What is pulmonary tuberculosis? So what is pulmonary tuberculosis? It is a contagious bacterial infection caused by Mycobacterium tuberculosis. So it is mainly a bacterial infection caused by tuberculosis, Mycobacterium tuberculosis. So what is the causative agents here? It is a bacteria. So it's a bacterial infection. So which bacteria is causing? It is caused by Mycobacterium tuberculosis, and it is mainly transmitted through airborne infection. So the persons who are having tuberculosis, if they'll cough or sneeze, the droplets will come out, the bacterial droplets will come out, and the person who is standing next to him or who is taking that breath, that person will get the infection. So it is a airborne infection. So it is droplets, through airborne droplet the infection will spread. So coming to signs and symptoms of pulmonary tuberculosis. So what signs and symptoms when the bacterial infection cause? The person will experience persistent cough, more than 3 weeks sometimes with blood. So if that person had 1 week cough, we can't predict that the person having tuberculosis. If that person have continuously 3 weeks or more persistent cough with coughing up of blood, then it is also one of the main signs and symptoms of tuberculosis. So coming to fever, so especially at night time लोगों को fever बढ़ जाते हैं. So fever वो लोग feel करते हैं night time को, and night sweats. So continuously sweating from the body. Night sweat also will come, and that is also a sign and symptom of TB. Weight loss and loss of appetite, chest pain and breathlessness, fatigue and weakness. So these are the main signs and symptoms of pulmonary tuberculosis. So mainly what are the signs and symptoms? Persistent cough more than 3 weeks, night sweats will be there, and night fever. So that person will have the body temperature will rise, कब rise होगा? Night time में ज़्यादा rise होगा. So ये pulmonary tuberculosis का signs and symptoms. So coming to diagnosis, कैसे diagnose करते हैं tuberculosis? First test is Mondos tuberculin test, TST, check for TB injection. So it's a main TB infection. So it's a main diagnostic test that we are using to find out tuberculosis. Montauk's tuberculin test, skin test. So chest X-ray shows lung damage or cavities. So through chest X-ray we can show that chest X-ray we can show that lung damage and the damages of cavities. And sputum test, AFB smear and culture detecting bacteria. Gene expert confirms TB and detects during drug resistance, and interferon gamma release assay detects latent TB. So these are the main diagnostic evaluation used to identify tuberculosis. So coming to what are the treatment and management of tuberculosis, that is also important. So tuberculosis may come for a long essay. So long essay में एक question आ सकते हैं. So management भी लिखना जरूरी है. So management कैसा है? Anti tuberculosis treatment, DOTS regimen. क्या है DOTS regimen? Directly observed short treatment short course, वो बोलते हैं DOTS. So DOTS has two phases. इसमें two phases है DOTS में. वो phase है, first phase is intensive phase and the second phase is and the second phase is continuation phase, 4 months or more. So दो phase है DOTS में. DOTS क्या है? Direct observed treatment short course में two phases, intensive phase, and in this intensive phase we are treating with isoniazid, rifampicin, pyrazinamide and ethambutol. So these kind of medicines, the first category of drugs we are administering in intensive phase for 2 months. So what are the medicine? Isoniazid, rifampicin and pyrazinamide and ethambutol. Coming to continuation phase, 4 months or more. So in the continuation phase it is 4 months or more. Isoniazid and rifampicin is the treatment for continuation. So it will be that person will coming from the intensive phase after 2 months, up to 4 months or more they will continue with the isoniazid and rifampicin. So this is the treatment with medical management. So medical management of tuberculosis. I hope everyone is getting my points. So coming to nursing management. So nursing management में कैसे करना है? Isolation and infection control. Keep the patient in a ventilator room and educate to cough etiquette. So keeping the patient in an isolated room to prevent the further infection for the patient as well as to prevent further infection for other person. So isolation and infection control is important because it's through airborne droplets, one person from another person the infection will spread. So we need isolation and infection control. Medication administration. So ensure DOTS adherence and monitor for side effects of medication. Nutritional support, because they have weight loss and loss of appetite, we need to see about the nutritional management also. So why we need to connect here? The symptom is weight loss as well as the loss of appetite. So that's why we need the nutritional management. Monitor and assess regularly vital signs, weight and sputum test. So through sputum test only we can able to identify the bacterial growth and reduction. So that is also important. Health education, teach treatment adherence, hygiene and follow care. So these are the main nursing management in the case of pulmonary tuberculosis. So coming to next question that we are going to discuss is a 2-mark question, DOTS and as well as revised national tuberculosis control program. ये both pulmonary tuberculosis के साथ में पढ़ना है, but एक 2 mark और 1 mark में meaning में आ सकते हैं. So what's a DOT? What is DOT? Directly observed treatment short course. It's a WHO Sorry for the trouble. So we'll continue. So DOTS क्या है? It's a WHO recommended TB control strategy program है. So WHO has recommended this program for where healthcare provider directly observe patient taking the TB medication. So इसमें directly the community health member or the health member directly observe करते हैं. क्या observe करते हैं? The patient is following the medication. So उन लोगों का responsibility है through directly observing. That is what called DOTS. So health agency में healthcare workers directly observe करते हैं the taking of TB medicine, insurance to adherence and preventing drug resistance. Coming to revised national tuberculosis control program, Indian government का एक program है to control the spread of TB. So Indian government has passed this law, revised national tuberculosis control program was India's national strategy for TB control launched in 1997. So in 1997 में launch किया है Indian government ने to control spread of tuberculosis based on directly observed treatment short course strategy to ensure effective diagnosis and treatment. So new cases को diagnose करना और new cases को treat करने के लिए Indian government ने conduct 1997 में enact किया ये law, that is revised national tuberculosis control program. So that is the definition. So coming to another important question that we are going to discuss is peptic ulcer. It's also one of a long essay or a short essay. So it may come for a long essay or short essay. So what is peptic ulcer? So क्या है peptic ulcer? It's an open sore or erosion in the lining of stomach, duodenum and esophagus caused by imbalance between stomach acid and mucosal defense. So इधर हमारा stomach में duodenum और stomach का lining में क्या होते हैं? Erosion और soreness due to कैसे होते हैं imbalance between the stomach acid and mucosal defense. So mucosal defense और stomach acid में एक imbalance हो गया तो balance में कुछ problem हो गया तो it will cause sore and erosion inside the stomach in duodenum as well as stomach and esophagus. That is known as peptic ulcer. So क्या पेप्टिक अल्सर का डेफिनेशन आपको पता चला होगा. So अभी हम लोग देखते हैं टाइप्स ऑफ पेप्टिक अल्सर. So पेप्टिक अल्सर 3 टाइप्स है, गैस्ट्रिक अल्सर, डिओडिनल अल्सर एंड ईसोफेगल अल्सर. So 3 टाइप्स है पेप्टिक अल्सर, एक है गैस्ट्रिक अल्सर, डिओडिनल अल्सर एंड ईसोफेगल अल्सर. अभी कॉजेस एंड रिस्क फैक्टर्स के बारे में बोलती हूँ. So कॉजेस एंड रिस्क फैक्टर में पहले आते हैं हेलिकोबैक्टर पाइलोरी और एच पाइलोरी इन्फेक्शन. सो इट इज मेनली कॉज्ड बाय द बैक्टीरिया एच पाइलोरी. सो हेलिकोबैक्टर पाइलोरी इन्फेक्शन. एक्सेस स्टोमक एसिड, हाइपर एसिडिटी. सो हमारा स्टोमक में एसिडिटी ज्यादा होता है तो हाइड्रोक्लोरिक एसिड द एसिडिक कंटेंट ज्यादा हो गया तो दैट इज ऑल्सो वन ऑफ द फैक्ट. लॉन्ग टर्म यूज ऑफ NSAID like aspirin and ibuprofen. So non-steroidal anti-inflammatory drugs में ज़्यादा यूज किया तो excessive intake किया तो वो भी एक रीजन है पेप्टिक अल्सर का. Smoking and alcohol. So alcoholism also is one of the main factor for peptic ulcer. Alcoholism will the stomach acid will increase and the alcoholism due to alcoholism and stress. These are the main risk factors and causes. So क्या है for risk factors? Helicobacter pylori infection because it's used to a bacteria H pylori infection. Excessive stomach acid, long-term non-steroidal anti-inflammatory drug use and smoking and alcoholism and also stress. So these are the main causes. So coming to signs and एंड सिम्टम्स, हम लोग साइंस एंड सिम्टम्स देखते हैं. व्हाट आर द साइंस एंड सिम्टम्स? बर्निंग, बेसिकली बर्निंग स्टमक पेन. सो वो पर्सन को बर्निंग स्टमक पेन होता है. सो एनीवे द स्टमक इट इज अफेक्टिंग. सो क्या होता है? स्टमक पेन. सो स्टमक पेन, बर्निंग स्टमक पेन, nausea, bloating or blenching. So feeling of nausea, bloating, blenching. So they will feel that nausea or vomiting will be there. Loss of appetite and weight loss. इसको loss of appetite हो जाता है वो person को और धीरे धीरे weight loss भी हो जाता है. Vomiting sometimes with blood. So कैसे vomit करेगा? With blood. Blood भी vomit करेगा. So vomiting sometimes with blood. Dark tarry stools due to internal bleeding. So bleeding के वजह से stomach का अंदर bleeding हो जाते हैं. Bleeding क्या वजह से क्या होते हैं? Stools. The stools they are passing will be dark and tarry due to internal bleeding. So these are the main signs and symptoms of peptic ulcer. So coming to treatment and management. So कैसे manage करते हैं? What are the treatment protocol? First is medication. So कैसे कौन सा medication हम लोग use करते हैं peptic ulcer stop करने के लिए? वो है proton pump inhibitors, omeprazole, pantoprazole to reduce the acid. So pantoprazole and is very common. So everyone knows this. Pantoprazole it's an antacid used to reduce the acid level. Proton pump inhibitor. So it's a proton pump inhibitor, omeprazole and pantoprazole. दूसरा मेडिसिन है H2 blockers, ranitidine, famotidine, reducing the acid production. So स्टमक का अंदर acid production होते हैं, वो acid production को reduce करने के लिए हम लोग H2 blockers यूज करते हैं. Example है ranitidine and famotidine. Coming to H. pylori infection, it's a bacterial infection. So bacteria कैसे manage करते हैं? Through antibiotics. Antibiotics यूज करके बैक्टीरिया को खत्म, बैक्टीरिया का reduction करते हैं. So the antibiotics we are using is clarithromycin, amoxicillin for H. pylori infection. So basically amoxicillin is the best and clarithromycin is the drug of choice for treatment. Antacids neutralizes stomach acid for symptom release. So also this is antacid also we are using to neutralizing the stomach acid. So the increased production of stomach acid will be there. So that we are neutralizing the production of stomach acid due to with the help of antacid. So these are the main medications. So treatment कैसे है? Medications it's mainly proton pump inhibitor, H2 blockers, antibiotics and antacid. दूसरा मैनेजमेंट है डाइट एंड लाइफस्टाइल मैनेजमेंट. सो कैसे डाइट एंड लाइफस्टाइल मैनेजमेंट विल हेल्प हियर? अवॉइडिंग स्पाइसी, एसिडिक एंड फ्राइड फूड. सो जंक फूड्स बेसिकली अवॉइड करना है. तो तुम आप लोग को और हम लोग को एक प्रॉब्लम हो गया, पेप्टिक अल्सर का प्रॉब्लम हो गया, तो पहले पेशेंट को क्या बोलना है? पेशेंट को बोलो अवॉइड स्पाइसी और एसिडिक और फ्राइड फूड्स, जंक फूड्स अवॉइड करने के लिए बोलना है. दैट इज द हेल्थ एजुकेशन आप लोग आपका पेशेंट को देना है विथ पेप्टिक अल्सर. ईट स्मॉल फ्रीक्वेंट मील्स. सो कैसे फ्रीक्वेंट मील्स करना है? सो ईट स्मॉल. सो एट द टाइम ब्रेकफास्ट स्मॉल मील्स, 8 o'clock they need to have, 11 o'clock they need to have again a small meal. So eating a small frequent meals. Quitting smoking and alcohol. So alcohol and smoking a main cause for peptic ulcer. So alcohol or quitting smoking is important. And managing stress with relaxation technique. Stress also is one of the factor for peptic ulcer. So कैसे manage करना है? Stress management वो भी important है manage करने के लिए peptic ulcer. So these are the management for peptic ulcer. So medications and diet and lifestyle modifications. Yes. So anyone have any doubts they can ask. So I'll clear that doubts if you have. So in the comment section you can comment it for the doubts. आप लोगों को कुछ डाउट है तो पूछो, मैं वो आंसर देती हूँ. सो हम लोग दूसरा क्वेश्चन डिस्कस करने वाला हूँ, टॉन्सिलाइटिस. सो टॉन्सिलाइटिस ऑल्सो अ इम्पोर्टेंट क्वेश्चन. सो क्या है टॉन्सिलाइटिस? डेफिनेशन ऑफ टॉन्सिलाइटिस इज अ इन्फ्लेमेशन ऑफ टॉन्सिल. सो हमारा टॉन्सिल्स का इन्फ्लेमेशन हो जाते हैं तो वो बोलते हैं टॉन्सिलाइटिस. व्हाट इज लाइटिस? इट इज इन्फ्लेमेशन. सो क्या है? टॉन्सिल का इन्फ्लेमेशन को क्या बोलते हैं? टॉन्सिलाइटिस. इट्स कॉज्ड बाय वायरल और बैक्टीरियल इन्फेक्शन. सो मे बी बैक्टीरिया और वायरल. So it is an inflammation of tonsils. So that's the definition. So coming to what are the signs and symptoms of tonsillitis. So tonsillitis का signs and symptoms क्या है? Sore throat and difficulty के लिए तकलीफ हो जाते हैं, swallowing तकलीफ हो जाते हैं. So that is what called sore throat and difficulty in swallowing. Swollen red tonsils sometimes with white patches. So कैसे tonsils का appearance कैसा है? Red color or it will be swollen. Swollen और red color appearance हो जाते हैं. Sometimes with white patches भी हो जाते हैं. Fever and chills. Infection है, infection आ गया तो क्या होते हैं? Fever and chills हो जाते हैं. Fever, infection is we will have the fever also. And bad breath, halitosis. So उन लोगों को breath में bad smell आ जाते हैं. Bad breath, that is also a signs and symptom of a tonsillitis. Painful or tender lymph nodes in the neck. So in the necks near to the tonsil in the neck area, the lymph nodes will be tender. So lymph nodes swollen हो जाते हैं. Swollen lymph nodes we can able to see through the palpation. Ear pain referred due to swollen tonsil. So from here the tonsil is swollen. So क्या हो जाते हैं? It's referring pain to ear. Ear also pain. Ear pain हो जाते हैं as a referred pain from tonsillitis. And loss of appetite and general malaise. So fever है तो general malaise होगा और loss of appetite भी होगा. ये symptoms of tonsillitis. क्या है symptoms here? Sore throat and difficulty swallowing, swollen red tonsils, fever and chills, bad breath, halitosis, it is known as halitosis. So bad breath is also known as halitosis. Powerful or tender lymph nodes in the neck, ear pain, referred pain due to swollen tonsils, loss of appetite and general malaise. So these are the main symptoms. Coming to nursing management. So nursing management is important. कैसे nursing management से nurse कैसे आप लोग manage करते हैं वो हम लोग discuss करेगा. Monitoring vital signs, check for fever, pain level and signs of complication. So patient को fever और chills है, so हम लोग को basically vital signs से monitoring करना पड़ेगा. Pain management, administer pain relievers as prescribed and encourage warm saline gargle. So salt water gargle करने के लिए बोलना है और pain medications administer करना है as prescribed by the doctor. And hydration and nutrition, ensure adequate fluid intake and soft soothing food to reduce throat discomfort. Discomfort कम करने के लिए adequate fluid intake is necessary. So सादा पानी पीना है और गर्म पानी पीना है. So that is also one of the management. Antibiotic adherence, educate the patient to complete the full course of antibiotics if bacterial infection is diagnosed. So if it is a bacterial infection क्या करना है? Antibiotics complete course लेना है. So that also as a nurse giving the health education, tell the patient to complete the treatment regimen or protocol. And infection control, teach good hygiene, hand washing and avoid sharing utensils to prevent the spread of tonsillitis. So क्या है tonsillitis? It is an inflammation of tonsils and it also will cause sore throat and difficulty in swallowing. So these are the symptoms and management. Yes, so anyone have any doubts? Please, we will discuss that doubts also in this class. So we are continuing with the next important question or next important topic, that is meningitis. So what is meningitis? Meningitis को क्या बोलते हैं? What is the definition of meningitis? It's the inflammation of meninges. क्या है meninges? The covering that supports the brain and spinal cord. So meninges क्या है meningitis? क्या है meninges? It's a protective membrane that covering the brain and spinal cord. So spinal cord और brain को protect करने के लिए हमारा brain में और spinal cord में एक membrane है meninges. So meninges को inflammation हो गया तो वो बोलते हैं meningitis. So that's the definition of meningitis. And it's usually caused by bacterial or viral infection. So either be the cause is bacteria or either virus. So meningitis is the inflammation of meninges. क्या है meninges? Meninges is the protective membrane that's supporting the brain and spinal cord. So coming to causes of bacterial meningitis, causes of meningitis, causes को types भी बोलते हैं. So here bacterial meningitis most commonly caused by Neisseria meningitidis. So the bacteria here is Neisseria Neisseria meningitidis. So bacterial meningitis. So first category, it is also a type bacterial meningitis. So second category is viral meningitis and is often caused by enterovirus, herpes simplex virus or mumps virus. So basically bacterial meningitis also occurs and as well as viral also there is a chance to occur. Fungal meningitis, other category or type of meningitis है fungal. So bacteria और virus का अलावा fungus भी meningitis का एक cause है. It is less common, caused by fungal infection like cryptococcus. So compare किया तो bacterial और viral meningitis ज़्यादा है fungal meningitis से ज़्यादा. So fungal meningitis is rare. And other causes are tuberculosis, certain medication or head injury leading to infection. So these are the main causes and types of meningitis. So कौन सा important है? Viral और bacteria important है along with fungal and other causes. So complication. So meningitis if left untreated, meningitis का complications कैसे होते हैं? क्या क्या complication हो जाते हैं meningitis का? It is seizures. Seizures is epilepsy. So that person will develop seizures. Hearing loss. So a hearing loss का. So it is meningitis will affect the hearing of capacity of person. So it's a complication. Meningitis को proper treatment नहीं किया तो hearing loss का और visual problem का हो जाते हैं और cognitive deficiencies or memory problems. It also affecting the memory and thinking capacity of the individual and if not treated properly, death of the individual also is possible. So these are the complications. So meningitis को अच्छे से treat नहीं किया तो ये complications आ सकते हैं. So these are the complications of meningitis. So coming to nursing management of meningitis. So as a nurse आप लोग कैसे मैनेज करेगा? What is the role of nurse in management? Infection control and monitoring. Implement droplet precautions, monitor vital signs, neurological status and signs of increased intracranial pressure. So आप लोगों को monitor करना है तो to prevent further spreading of infection and to control the ICP, intracranial pressure. So intracranial pressure बढ़ जाते तो और stroke के लिए stroke और cerebrovascular accident हो जाते. So इसलिए हम लोग को infection control and monitoring also important and medication administration. So antibiotics or antiviral medication. If it is a fungal case, antifungal medications and pain and fever management. Providing fever control and manage headaches with prescribed analgesics. So meningitis होते हैं तो the person have headache, सिर दर्द होगा, सिर दर्द management and fever control भी important है and hydration and nutrition support. Maintain fluid and electrolyte balance through IV fluids and maintain adequate nutrition. So fluid intake also is important. Adequate nutrition also maintain करना है through IV fluids and nutritional support. And patient comfort and safety measures. So ensure the patient to take rest. आपको आपका patient को बोलना है rest करने के लिए और more fluid लेने के लिए और nutritional therapy भी important है. And as a nurse you want to control the spread of further infection and to prevent the decrease or increase in the ICP, intracranial pressure. ये है nursing management of meningitis. आपको समझ में आया होगा. सो अभी मैं डिस्कस करने वाला हूँ अदर इंपॉर्टेंट डिसीज दैट इज नेफ्रोटिक सिंड्रोम, किडनी डिसऑर्डर. इट्स अ किडनी डिसऑर्डर. सो व्हाट इज नेफ्रोटिक सिंड्रोम डिस्कस करते हैं. So nephrotic syndrome is a kidney disorder. So कहा हो जाते हैं किडनी को. It is affecting the kidney. Increased protein loss in the urine. So it is characterized by increased loss of protein in urine. So through urine protein loss हो जाते हैं. So a condition को बोलते हैं protein urea. So what is protein urea? Increased loss of protein in the urine and leading to low levels of protein in the blood, hypoalbuminemia. So protein का level decrease हो गया तो वो condition को बोलते हैं hypoalbuminemia. So protein through protein. So here in this condition nephrotic syndrome that person's urine. So in urine there will be loss of protein. ये लॉस ऑफ प्रोटीन में बाद में क्या होता है? लॉस ऑफ प्रोटीन ज्यादा हो गया तो हाइपोअल्बुमिनीमिया. सो हाइपोअल्बुमिनिया हो जाता है और स्वेलिंग, एडिमा इन द लोअर लेग्स. सो पैर में एडिमा हो जाते हैं, स्वेलिंग हो जाते हैं एंड हाई कोलेस्ट्रॉल लेवल्स इन द बॉडी. सो इट रिजल्ट फ्रॉम डैमेज ऑफ ग्लोमेरुलाई फिल्टरिंग यूनिट ऑफ किडनी. कैसे हो जाते हैं? किडनी का फिल्टरिंग यूनिट ग्लोमेरुलाई को डैमेज हो गया तो ये सब सिम्टम्स होते हैं. that is it's a syndrome, group of symptoms. क्या symptoms है इस nephrotic syndrome में? Loss of protein in urine, that's why they will have hypoalbuminemia, decreased protein level in blood and swelling in the legs. Edema will be present with high cholesterol. So 4 symptoms. So that is what called syndrome. Group of symptoms is called syndromes. That is why it is nephrotic syndrome. कैसे हो जाता है? It results from कैसे? Damage to the filtering unit of kidney, that is glomeruli. So this is the definition. I hope everyone understood. So coming to signs and symptoms, clinical manifestations में क्या क्या symptom हो जाते हैं वो पेशेंट को क्या क्या symptom हो जाते हैं? Swelling, edema बोल दिया ऑलरेडी हम लोग डिस्कस किया है डेफिनेशन में. edema हो जाते हैं swelling in the extremities पैर पे और in the edema will be there in the extremities hands and पैर. So legs. Proteinuria. What is proteinuria? Increased loss of protein in the blood. Blood में protein का loss हो जाते हैं. That is proteinuria. Due to this proteinuria loss of protein in urine, it will lead to hypoalbuminemia. So the level of protein in the blood will also decrease. हाइपरलिपिडीमिया क्या है? हाइपरलिपिडीमिया हाई कोलेस्ट्रॉल लेवल को बोलते हैं हाइपरलिपिडीमिया. फटीग एंड जनरल वीकनेस, वो पेशेंट को वीकनेस भी हो है. एक्सक्यूज मी. fatigue and general weakness, loss of appetite and possible weight gain due to fluid retention. So urine में protein ज्यादा जाते हैं, so urine properly और urine pass नहीं हो जाते. So क्या हो जाते हैं? Fluid retention. So water content in the body will reabsorb. So retention in the body, that's why weight gain also will be there. So body में और reabsorb हो जाते हैं water. यूरिन में जाना है, waste जाना है, but नहीं जाए तो क्या हो जाते हैं? Retention हो जाते हैं, swelling हो जाते हैं, weight gain हो जाते हैं. So that is also one of the symptom. And hypertension. Due to this cases, high blood pressure in some cases also we can detect. So these are the signs and symptoms of nephrotic syndrome. Coming to complications. So complications कैसे होते हैं? क्या क्या complications हो जाते हैं? Infection. So kidney को affect हो जाते हैं तो बाद में infections हो जाते हैं. Urinary tract infections will be common or other kind of skin infections also can occur. Acute kidney failure. So kidney fail हो जाते हैं बाद में. So fluid through protein is going through the urine and the water. Other than the waste is not going, then what will happen? क्या हो जाते हैं? Acute kidney failure. Kidney failure हो जाने का भी chances है. Blood clot due to changes in blood protein. Albuminemia, hypoalbuminemia. So the level of albuminemia is less. That there is a chance blood clot formation. So formation of blood clot in the body, that is also a danger situation. And nutritional deficiencies from protein loss and malnutrition. So हम लोग क्या खाना खाते हैं उसका पूरा प्रोटीन यूरिन से निकल जाते हैं तो क्या हो जाते हैं? malnutrition and nutritional deficiency. So this is the complications in the case of a nephrotic syndrome. So nursing management of patients with renal system disorders. So not only nephrotic system हम लोग इधर डिस्कस कर रहे हैं, किडनी डिसऑर्डर और नेफ्रोटिक रीनल सिस्टम में कुछ डिसीजेस हो गया तो कैसे मैनेज करना है वो डिस्कस करेगा. मॉनिटरिंग फ्लूइड एंड इलेक्ट्रोलाइट बैलेंस. सो इट इज मेनली अफेक्टिंग रीनल सिस्टम डिसऑर्डर्स का मतलब क्या है? किडनी डिसऑर्डर. सो किडनी को अफेक्ट कर रहे हैं, इसलिए हम लोग को क्या देखना है? मॉनिटरिंग फ्लूइड एंड इलेक्ट्रोलाइट बैलेंस. सो इलेक्ट्रोलाइट बैलेंस को देखना है. असेस द इनटेक एंड आउटपुट चार्ट्स. मेंटेन द इनटेक एंड आउटपुट चार्ट ऑफ पेशेंट, डेली वेट, एडिमा एंड साइंस ऑफ फ्लूइड ओवरलोड और डिहाइड्रेशन. सो क्या क्या चेक करना है? Monitoring fluid and electrolyte balance is very important. First management in the case of kidney disorders. Coming to दूसरा management है managing blood pressure and cardiovascular health. So monitoring BP regularly, administer antihypertensives and assess for heart complications. So kidney को affect करेगा पहले तो वो बाद में hypertension ऐसे complication hypertension it will cause. hypertension हो गया तो cardiovascular, so heart को भी affect करेगा. So we need to stop that also. Administer medications and monitoring labs, providing diuretic, phosphorus binders, erythropoietin and monitor blood urea, nitrogen. What is bun here? Blood urea nitrogen. blood urea, nitrogen, creatine, electrolytes and GFR we need to see. So these are the main things we need to monitor in the lab reports. Also we need to monitor and administer medication. Dietary management, restrict sodium, potassium and protein intake as per renal function, encourage adequate calories. So calories ज़्यादा लेने के लिए encourage करना है और and restrict क्या क्या restrict करना है, sodium, potassium as well as protein intake को restrict करना है. So that is also important. Prevent and manage complications, monitor for signs of uremia, infection, metabolic acidosis and provide dialysis care if required. So kidney damage हो गया तो क्या करना है, dialysis require cases है तो हम लोग को वो भी देना है. Dialysis services also you need to assess staff nurse, you need to ensure the person is getting dialysis services if it is very complicated case. So that is the total management, nursing management of renal system. So renal system disorders को manage करने के लिए mainly हम लोग को क्या क्या monitor करना है, urine output monitor करना है, blood pressure, vital signs monitor करना है और edema patient को observation चाहिए, inspection of edemas in the legs वो भी चाहिए and the lab report also is important as well as monitoring the intake and output chart. So fluid level is very important and if the patient is requiring dialysis, you need to consult for that also. These are the management. Yes. So coming to another important questions that we are going to see is liver cirrhosis. What is liver cirrhosis? Let's discuss. So cirrhosis is a scarring of liver tissue, usually long-term liver damage from causes like chronic alcohol use, viral hepatitis and fatty liver disease. So क्या है liver cirrhosis? It's the scarring of liver tissue usually due to long term liver damage. So liver damage हो जाते हैं, scarring of tissues का death और scarring हो जाते हैं, तो that condition is liver cirrhosis caused by कैसे हो जाते हैं? So mainly the cause is alcohol use and viral hepatitis, fatty liver disease. So that's the definition of liver cirrhosis. Cirrhosis का मतलब है cirrhosis is mainly affecting liver. Liver cirrhosis is the scarring of liver tissue and it's due to long term damage of tissues of liver. It's mainly due to alcoholism and viral hepatitis, fatty liver disease. So एक पिक्चर से हम लोग को पता चला है this is a healthy liver. So देख सकते हैं आप healthy liver कैसे हो जाते हैं और cirrhosis को cirrhosis liver कैसे, the color change, the texture change, how the entire liver is changed, हम लोग को एक पिक्चर से पता चलता है. So है healthy liver और a cirrhosis liver का difference. नर्सिंग मैनेजमेंट डिस्कस करने के पहले हम लोग साइंस एंड सिम्टम्स देखते हैं. सो साइंस एंड सिम्टम्स में क्या हो जाते हैं, फटीग एंड वीकनेस. सो इट इज अफेक्टिंग लिवर. सो फटीग एंड वीकनेस. जॉन्डिस कैसे, जॉन्डिस बाइल प्रोडक्शन ज्यादा होता है. सो फ्रॉम द लिवर बाइल प्रोडक्शन विल इंक्रीज. सो जॉन्डिस येलोइश डिस्कलरेशन ऑफ बॉडी एज वेल एज एंड द आईज. सो जॉन्डिस हो जाते हैं. अस्काइटिस, सो फ्लूइड रिटेंशन इन द स्टमक. सो फ्लूइड विल बी रिटेन्ड. वो फ्लूइड अब्सॉर्प्शन फ्लूइड एलिमिनेशन नहीं हो जाते, सो अब्सॉर्प्शन हो जाते हैं. अस्काइटिस, सो फ्लूइड फिलिंग इनसाइड द स्टमक. एडिमा, पैर पे लेग पे एडिमा हो जाते हैं. सो एक्सट्रीमिटीज में एडिमा हो जाते हैं. नोसिया एंड लॉस ऑफ एपेटाइट, एब्डोमिनल पेन, इची स्किन. सो लिवर सिरोसिस का एक और सिम्टम है इची स्किन, प्रूराइटिस. सो द स्किन ऑफ दैट पर्सन हिला इचीनेस. सो दैट इज ऑल्सो वन ऑफ द स्किन. ब्रूइसिंग और ब्लीडिंग. सो ब्लीडिंग हो जाते हैं, ब्रूइसिंग, ईसी ब्लीडिंग एंड ब्रूइसिंग along with confusion or personality changes. So these are the signs and symptoms. So क्या क्या है signs and symptoms? Mainly jaundice हो जाते हैं. Pruritus, what is pruritus? Itchy skin, itchiness, bruising और easy bleeding हो जाते हैं. Confusion of personality change, abdominal pain, nausea and loss of appetite, edema and ascites. So these are the main signs and symptoms. Now we will come back to the nursing management. So कैसे nursing management, as a nurse आप लोग क्या करते हैं, कैसे manage कर सकते हैं. So monitor vital signs. क्यों मॉनिटर करना है vital signs? To check for the signs of liver damage or liver failure like jaundice, abnormal liver enzymes and bleeding. So हम लोग को LFT liver function test करना है. That is the important one. And it is a diagnostic evaluation. So here itself मैंने diagnostic evaluation भी बोल दिया. What it is? LFT, liver function test. So manage fluid balance, monitor for ascites, edema and adjust diuretics as needed. So कैसे diuretics, monitor for the edema and manage the administration of diuretics. That is also one of the important thing. Coming to administer medication, ensure proper use of prescribed medication including diuretics, lactulose and antivirals. So medicines, what are the main medicines we are giving? Treatment is here diuretics, lactulose and prescribed medications. So coming to nutritional support, provide high protein, low sodium diet and manage deficiencies like vitamin K. So कैसे हम लोग diet therapy कैसे है? Diet therapy depends on high protein, low sodium diet. Patient education, teach about lifestyle changes. क्या क्या lifestyle changes हम लोग को बोलना है? Alcohol consumption, to stop the alcohol consumption along with medication adherence and signs of liver failure. So educate about the disease condition के बारे में health education देना है, and also about the improved life, balanced diet, physical activity and the stopping or cessation of alcohol. So alcohol is the main use. Chronic alcohol use is the main cause for hepatitis. So liver cirrhosis. So liver cirrhosis कम करने के लिए that person need to stop alcohol. So that is a health education that you can give as a nurse to the patient, your patient. Yes. So another important question that we are going to discuss is head injury. So what is head injury? Let's see. A head injury refers to any trauma to the skull, scalp or brain that can result in damage. Head को इंजुरी हो गया तो हेड को डैमेज हो गया तो दैट इज व्हाट कॉल्ड हेड इंजुरी. सो इट्स अ ट्रॉमा टू हेड मेनली. कैसे? एक्सीडेंट्स, रोड ट्रैफिक एक्सीडेंट और एक्सीडेंट, दैट इज द मेन कॉज हेड इंजुरी और दैट पर्सन फेल डाउन इन अ प्लेस और ही फेल डाउन फ्रॉम अ हाइट. सो क्या हो जाता है? हेड इंजुरी. हेड इंजुरी का मतलब क्या है? ट्रॉमा टू द हेड, स्कल, स्कैल्प और ब्रेन. Either skull or scalp or brain को इंजुरी हो गया तो that is what called head injury. Yes. So coming to types of head injury. Head injury का types क्या है? Closed head injury. So there won't be any injury, won't be visible, but there is injury. It is closed injury. Concussion, contusion, open head injury, diffuse axonal injury, penetrating head injury. So penetrating head injury का example है gunshots. That is a example. So क्या क्या है types of head injury में? क्या है? Head injury, closed one, concussion, contusion, open head injury, diffuse axonal injury, penetrating head trauma or head injury. So these are the main types. So coming to another important question, that is pneumonia. So it's a respiratory disorder condition and it is also a very important question. So one of the important questions that may come for the exam हो है pneumonia. So क्या है pneumonia? Pneumonia का definition क्या है? Pneumonia is an infection of lungs that causes inflammation of the air sac. So infection of lung का infection है where inflammation of air sacs, alveoli का inflammation हो जाते हैं, बाद में उसमें fluid और pus filling. So fluid or pus filling in the alveoli due to infection and inflammation of lungs. That is what called pneumonia. So pneumonia is an infection of lungs that causes inflammation in the air sacs, alveoli which may be filled with fluid or pus. So that is the definition. So definition is very important. So pneumonia is very important. Coming to stages of pneumonia. So what are the stages? Stage 1 is congestion, 24 to 72 hours. So after the initial infection. So initial infection के impact के वजह से पहला stage है congestion. Congestion stage में 24 hours to 72 hours में congestion feel हो जाते हैं. बाद में second day 3 to day 4 में red hepatization हो जाते हैं. Day 5 to 7 में gray hepatization and day 8 and beyond it will be resolution. So the symptoms will resolution of the symptoms. So these are the stages. Stage में congestion, red hepatization, gray hepatization and resolution. Types. So pneumonia has defined in different types. कैसे? Let's discuss. So the first type is community acquired pneumonia. Pneumonia acquired outside the hospitals, commonly caused by Streptococcus pneumoniae or virus. So first one is community acquired pneumonia. Second one, hospital acquired pneumonia. From the name itself, we can able to see that hospital occurs 48 plus hours after hospitalization. So the patient or the person is coming with admitted to hospitalization and after 48 hours वो patient को pneumonia हो जाते हैं तो ये categorize होगा hospital acquired pneumonia में. So it's due to from the infection is secondary and it's coming from the hospital. So क्या बोलते हैं hospital acquired pneumonia. Ventilator associated pneumonia develops 48 to 72 hours of after intubation in ventilated patient. So intubated patients को ventilator associated pneumonia होने का chances है. So क्या है after 48 to 72 hours. If that is patient is suffering with ventilator associated pneumonia का मतलब क्या है? Due to intubation the person has developed with the pneumonia. That is what called ventilator associated pneumonia. Aspiration pneumonia, the fourth type, caused by inhalation of food, liquids or gastric content common in stroke or unconscious patient. So unconscious patient or stroke patient may developing to aspiration. So that stomach content they will aspirate it. That is what called aspiration pneumonia. As a result, it will cause pneumonia. Lung infection may occurs. Last one is atypical pneumonia. Milder pneumonia caused by atypical bacteria like Mycoplasma pneumoniae, often called walking pneumonia. So ये सब है main types. So क्या क्या है सब main types? Community acquired pneumonia, hospital acquired pneumonia, ventilator associated pneumonia, aspiration pneumonia and atypical pneumonia. Coming to nursing management of pneumonia. So as a nurse क्या क्या आप कर सकते हैं? क्या कर सकते हैं here? Airway clearance and oxygen therapy. Encourage deep breathing, coughing, suctioning if needed. Provide oxygen therapy as prescribed. So कैसे airway clearance and oxygen therapy is important because they have lung infection. So there is a chance mucus production, secretions will be building up in the lungs. So what we need here? Suctioning. So suctioning if necessary, do the suction, encourage them for deep breathing, coughing and provide oxygen therapy if indicated by the doctor. Next one is medication administration. Administer antibiotics. Why antibiotics? Because it is maybe caused by the bacteria, then we need to give the antibiotics. Antipyretics, bronchodilators and analgesics as per treatment plan. So medication administration. So treat with proper medication. Bacterial infection है तो bacterial antibiotics से treat करना है. Fever है तो antipyretics is necessary. Bronchodilators. So inflammation कम करने के लिए bronchodilators enough and analgesics too as per the treatment plan. Monitor respiratory status. Assess breath sound. So changes in breath sound indicates infection. Assess breath sound, oxygen saturation, respiratory rate and watch for signs of respiratory distress. Hydration and nutrition support. Encourage fluid intake to loosen secretion. So you need to explain your patient the importance of having water. So tell them to drink more water to loosen the secretion. So क्यों हम लोग water ज़्यादा पीना है? To loosen the secretions and provide adequate nutrition to support immunity. Infection control and prevention. Maintain proper hand hygiene. Educate the vaccination like influenza, pneumococcal and promote early ambulation. So these are the nursing management for pneumonia. Clear everyone? सबको समझ में आ रहा है क्या? कुछ डाउट्स है तो पूछ सकते हैं आप लोग. सो हम लोग अदर क्वेश्चंस डिस्कस करेगा मीनिंग्स. सो हम लोग अभी मीनिंग्स सब वर्ड्स का मीनिंग्स वी विल स्टडी. सो व्हाट आर द मीनिंग्स वी विल स्टडी. फर्स्ट वन इज एनाफाइलासिस. सो एक मार्क क्वेश्चन से मीनिंग 1 mark questions. So first is anaphylaxis, a severe life-threatening allergic reaction causing difficulty in breathing, swelling and drop in blood pressure. So definition क्या है? A severe. What is anaphylaxis? एक severe life-threatening allergic reaction है. Severe life-threatening allergic reaction causing क्या क्या हो जाते हैं anaphylaxis situation में? Difficulty in breathing, swelling and drop in blood pressure. So that is what called anaphylaxis. So the second one is fistula. Second important question, that is 1 mark question, usually come for the exam है fistula. An abnormal connection between two body organs or vessel. So एक vessel और एक body, दो body organs के बीच में एक abnormal connection है, वो होता है fistula. So what is it? It is defined as an abnormal connection between two body organs. So two body organs के बीच में एक abnormal connection बन गया, that is called fistula. Often resulting from injury, surgery or disease. Maybe due to some injury, surgery or a disease. So it's a abnormal connection between two body organs. So third one, fumigation. What is fumigation? It's a process of disinfecting the area using chemical vapors or gases. So in an OT, example OT, operation theatre, we will fumigate the operation theatre. Why fumigating? It's a disinfection technique used in using chemical vapor or gases to eliminate harmful microorganisms, pests or contaminants. So example है OT में fumigate कर रहे तो उसका मतलब है using chemical agent use करके microorganisms को kill करना और microorganisms को eliminate करना, वही है that procedure is called fumigation. Fourth one is nursing process. क्या है nursing process? A systematic patient-centered approach in nursing that involves assessment, diagnosis, planning, implementation and evaluation of care. So nursing process is 5 steps. What are the 5 steps? Assessment, diagnosis, planning, implementation and evaluation. So वो बोलते हैं nursing process. So assess करना, assess में two things is important. Subjective data, patient का data. Patient क्या बोलते हैं, वही subjective data and objective data. As a nurse क्या हम लोग observe कर रहे हैं, वो भी objective data. Planning, implement, diagnosis. From this data, we will diagnose the patient condition, diagnose करेगा. बाद में planning में कैसा care plan देना है, care कैसा देना है, वो plan करेगा. Planning करने के बाद implementation. So वो plan implement करेगा, बाद में evaluation करेगा. So that is the nursing process. Now coming to fifth question, that is glossitis. Glossitis is the inflammation of tongue. So tongue में infection हो जाते हैं तो क्या बोलते हैं? Glossitis. Glossitis is the inflammation of tongue causing redness, swelling, pain and difficulty speaking or eating. So that is what called glossitis. It is nothing but the inflammation of tongue causing redness, swelling, pain and difficulty in speaking and eating. Next one is injury. What is the meaning of injury? In any physical harm or damage to the body caused by accident, trauma or external force. So external force or trauma or injury or accident के वजह से हम लोगों का physically harm होगा और body को damage हो गया तो वो बोलते हैं injury. So that's the definition of injury. And edema. क्या है edema? It's an abnormal swelling caused by fluid accumulation in tissue. Tissue में abnormally fluid accumulate हो जाते हैं तो edema, swelling हो जाते हैं. So swelling और edema is the same word. And often due to infection, heart failure, kidney disease. So kidney disease or infections or any heart disease they are suffering, they will have swelling. Swelling का मतलब है edema. Edema और swelling is same. Accumulation of abnormal fluid accumulation inside the tissues. That is the meaning. So coming to atelectasis. So another important question that is coming for meaning. Write the meaning of atelectasis. So what is atelectasis? Partial or complete collapse of lung or lung segment due to blocked airway or insufficient air entry. So that is what called atelectasis. So what is atelectasis? The definition: partial or complete collapse of lung. Lung का partial or complete collapse due to or lung segment due to blocked airway or insufficient air entry. So in either it is due to blocked airway or due to insufficient air entry, complete or partial collapse of lung. That is what called atelectasis. So these are the main questions that may come for meaning. So write the meaning of following. Yes, I hope everyone understood. Yes, so we will discuss some more meanings, that is fumigation, that already we have discussed. Sorry for I added extra, sorry for that. Gingivitis, so it is the inflammation of gum. So gums को inflammation हो गया तो क्या बोलते हैं? Gingivitis and usually caused by bacterial infection leading to redness, swelling and bleeding. So that's the definition. Next is hemorrhoids. So hemorrhoids का मतलब क्या है? Swollen blood vessels in the lower rectum or anus that can cause pain, itching and bleeding. So anum और rectum में swelling, swollen red blood हो जाते हैं. So blood cells का सॉरी ब्लड वेसल्स swollen हो जाते हैं तो क्या बोलते हैं? It is known as hemorrhoids. And ataxia, it's a neurological condition caused by lack of muscle coordination affecting balance and movement. So that person will have irregular muscle movements without control. Involuntary movements will be there in the muscle. So condition है बोलते हैं. And it's a neurological condition known as ataxia. So it's a neurological condition characterized by lack of muscle coordination affecting a balance and movement. Yes, till now we only discussed about medical surgical nursing 1. Now I know time is going on, but we will discuss about medical surgical nursing 2 also, because that is also one of the important exams. So you have 2 papers to write, med surg 1 and med surg 2. So let's discuss, guys. So the first question we are going to discuss is angina pectoris. So angina pectoris का मतलब क्या है? Nothing but chest pain or chest discomfort. It's also known as a chest pain or chest discomfort caused by reduced blood flow to heart muscle. Sorry for the trouble. We will continue with med surg 2. We will continue fast as possible. So angina pectoris is a chest pain or discomfort caused by reduced blood flow to the heart muscle. So heart muscles को enough blood नहीं मिलता तो क्या हो जाते हैं? Chest pain or chest discomfort. So chest pain is also known as angina pectoris. So that's the definition here. So coming to types, angina pectoris का types क्या है? Stable angina, unstable angina, refractory angina, variant angina and silent angina. So these are the main 5 types of angina: refractory, unstable, stable, variant angina and also silent angina. So these are the types. Angina का मतलब क्या है? Chest pain. Don't forget that. Don't confuse. Chest pain is angina pectoris. क्यों chest pain होते हैं? Insufficient blood supply to the heart muscles. So coming to surgical intervention. So angina pectoris का surgical intervention also is important. That is also come for a 1 mark question. So percutaneous coronary intervention, PCI, also known as angioplasty. So angioplasty is also known as percutaneous coronary intervention. Involves inflating a balloon in the blocked artery to widen it, followed by a placement of stent. So placement of surgeon will place the stent inside the artery. So the blocked artery or due to some insufficient supply to the heart muscle, angina will occur. So here what will happen? We will do the percutaneous coronary intervention, stent placement in the artery walls. Coronary artery bypass grafting, also known as bypass surgery. You are familiar with the word bypass surgery. So what is bypass surgery? Coronary artery bypass grafting, a surgical procedure that involves creating new pathways for blood to reach the heart muscle, bypassing blocked artery. So this is the surgical interventions in the case of angina. So don't confuse with angina. Angina का मतलब क्या है? Angina pectoris is chest pain. So as that is simple. Yes. So types, and you need to study about the management. Coming to nursing management. So what are the nursing management? Pain relief. Administer nitrates. Example, nitroglycerin. So the medication also I am teaching you here. The treatment, medical treatment is pain medication, administering nitroglycerin. So nitroglycerin is administered to sublingual. What is sublingual? Under the tongue. So that tablet will keep under the tongue of that person. So it is not swallowed, it will keep under the tongue. So that is the first one, that is administering nitrate. So nitroglycerin is the drug of choice for the treatment of angina pectoris to relieve chest pain and improve blood flow. Oxygen therapy. Why angina pectoris occurs? Lack of oxygen. So oxygen support, oxygen का कम हो जाते हैं, हार्ट मसल में ऑक्सीजन कम हो जाते हैं, कम हो जाने के वजह से हो जाते हैं एंजाइना. सो एंजाइना को ट्रीट करने के लिए हम लोग का दूसरा ऑप्शन है ऑक्सीजन थेरेपी. मॉनिटर वाइटल साइंस, रेगुलर असेस हार्ट रेट, ब्लड प्रेशर एंड ऑक्सीजन सैचुरेशन टू ट्रैक द कंडीशन. मेडिकेशन, एडमिनिस्टर एंटी एंजाइनल मेडिकेशंस लाइक अनदर एंटी एंजाइनल मेडिकेशंस हियर अदर देन नाइट्रोग्लिसरीन. क्या क्या मेडिसिन हम लोग दे सकते हैं? बीटा ब्लॉकर्स, कैल्शियम चैनल ब्लॉकर्स एंड एस्पिरिन एज प्रिस्क्राइब्ड बाय द डॉक्टर. सो क्या क्या मेडिसिन है बोलना नहीं. नाइट्रोग्लिसरीन, अंडर द टंग सबलिंगुअली एडमिनिस्टर करेगा कैल्शियम चैनल ब्लॉकर्स, बीटा ब्लॉकर्स एंड एस्पिरिन. पेशेंट एजुकेशन. Educate the patient about lifestyle changes, stress management and medication adherence to prevent future episodes. So preventing future episodes हम लोग को give the health education to the client. So these are the maintenance management of angina pectoris. Yes. So next important questions that we are going to discuss is hypertension. So what is hypertension? You need to tell me what is hypertension, the definition. So let's see what is the hypertension definition. So hypertension क्या मतलब है, क्या है? High blood pressure. So high blood pressure condition where the force of blood against the walls of arteries is consistently too high. So it's a artery. It's artery, blood flowing occurs. So consistently the pressure is increasing inside the artery. The force of blood passing to the artery, if the blood, the condition where force of blood against the artery wall. So where is a force, the blood is against the artery wall. So that force increases, it will lead to hypertension. So normal blood. So consider this is an artery. So blood is flowing through the artery. So इधर प्रेशर, ब्लड फ्लो का प्रेशर बढ़ जाते तो आर्टरी वॉल में क्या हो जाते, आर्टरी वॉल का कंसिस्टेंटली फोर्स बढ़ जाते. सो उसमें उसके वजह से क्या हो जाते हैं, बीपी इंक्रीज हो जाते हैं. सो इंक्रीज ब्लड प्रेशर. So that's a simple definition. So it's a condition where the force of blood against the walls is increased or arteries is consistently too high. It is defined as blood pressure reading 140/90 mm of Hg or higher. So if that person is having a 140 mm of Hg and higher for a prolonged period of time, then that person is categorized as hypertension. So hypertension is divided into mainly primary hypertension and secondary hypertension, where primary hypertension there is no cause at all. उधर एक cause unknown है, cause हम लोग को पता नहीं, but the person will develop hypertension, then उसको बोलते हैं primary hypertension. Secondary hypertension उसका एक reason हो जाए, maybe diabetes mellitus. So as a diabetic mellitus patient उसको develop हो जाते, there is a chance that person will develop a hypertension, then it is coming under secondary hypertension. So two types, primary and secondary. So coming to medication, medication management is very important in hypertension. So क्या है medication management here? It is diuretics that helps to remove the excess water and salt from the body, reducing blood volume. So first drug of choice is diuretics. Second is ACE inhibitors. What is ACE inhibitors? Angiotensin converting enzyme inhibitors help to relax the blood vessels and reducing the blood pressure. Angiotensin 2 receptor blockers similar to ACE inhibitors but may have fewer side effects. Beta blockers, calcium channel blockers, alpha blockers, renin inhibitors. So these are the main drug of choice in the treatment of hypertension. So it is a classic drugs. So these drugs are mainly used to treat patients with hypertension. So what are the drugs? Diuretics, ACE inhibitors, angiotensin 2 receptor blockers, beta blockers, calcium channel blockers, alpha blockers, renin inhibitors. So coming to another important question that we are going to discuss is glaucoma. So what is glaucoma? It's a group of eye disease. So कैसे? It's an eye disorder. It's affecting the eyes of the human. So eye disorder caused by damage to optic nerve due to intraocular pressure. So in the eyes, the intraocular pressure is increasing. So due to this, what happens? So it will lead to damage to the optic nerve. So optic nerve will be damaged, and this optic nerve damage is referred to as glaucoma. Clear? The definition is very easy. No, due to increased intraocular pressure inside the eyes, there will be damage to the optic nerve. This damage in the optic nerve leads to glaucoma. So that's the definition of glaucoma. What is the nursing management here? Monitor IOP. What is IOP? Intraocular pressure. Regularly check the patient's intraocular pressure to assess the treatment efficiency. Administer medication. Ensure proper use of prescribed eye drops or medications to IOP control. Ensure proper use of prescribed eye drops. So that person need to use eye drops and to control the intraocular pressure, and provide education. Educate patients on proper medication use, the importance of routine eye exams and lifestyle changes. मॉनिटर साइड इफेक्ट्स, सो असनर्स आप लोगों को क्या करना है, साइड इफेक्ट्स मॉनिटर करना है. वॉच फॉर पोटेंशियल साइड इफेक्ट्स ऑफ मेडिकेशन सच एज आई इरिटेशन एंड सिस्टमिक इफेक्ट्स, encourage compliance or ensure patients adherence to prescribed treatment medicine. So eye diseases है, so control करना है, IOP इंट्राओकुलर प्रेशर कंट्रोल करने के लिए वो पेशेंट को मेडिसिन लेना ही पड़ेगा. So about teach about the importance of treatment. So that's coming to glaucoma. This is the definition of nursing management. Next important question that is coming previous year question paper. So I saw this question in the previous year question paper. So that's I will discuss now. It's defibrillator. So what is defibrillator? It's a medical device used to deliver electric shock to the heart to restore normal rhythm in case of life-threatening cardiac arrhythmias. So हम लोग देखते हैं ना movies में heart में beat हो जाते हैं. Yes, ऐसा ही है. क्या है defibrillator? Medical device used to give electric shocks to heart. हार्ट को इलेक्ट्रिक शॉक देने के लिए हम लोग यूज करते हैं डिफिब्रिलेटर. एंड टू रिस्टोर, व्हाई वी आर यूजिंग, टू रिस्टोर द नॉर्मल रिदम इन केसेस ऑफ लाइफ थ्रेटनिंग कार्डियक अरिथमियासिस. सो कार्डियक अरिथमियासिस मतलब क्या है, इरेगुलर हार्ट बीट. अरिथमियासिस नथिंग बट इरेगुलर हार्ट बीट. सो इरेगुलरली बीटिंग हार्ट और हार्ट का कंडीशन है अरिथमिया. सो टू ट्रीट दैट एंड टू रिस्टोर द नॉर्मल हार्ट रेट एंड रिदम वी आर यूजिंग डिफिब्रिलेटर. सो सम मूवीज example, I know, you know, already you know guys, already you are watching movies, you know this defibrillator, right? I know you in hospitals, if you didn't see, also in movies you are definitely watched this. So it's a defibrillator. So such as ventricular fibrillation. So it's one of the arrhythmia, that is ventricular fibrillation and pulseless ventricular tachycardia. So in these conditions, we are giving a shock directly to the heart to restore the normal heart rhythm. That is what called defibrillator. So here we can able to see defibrillator. So through restoring the normal rhythm. So coming to types. So what are the types of defibrillators here? Automated external defibrillator, manual defibrillator, implantable cardioverter defibrillator and wearable cardioverter defibrillator. So there are mainly 4 types of defibrillator that is used in the present case scenario. So क्या है वो सब automated external defibrillator. So first one, second है manual defibrillator, third one is implantable cardioverter defibrillator and wearable cardioverter defibrillators. So indications, क्यों हम लोग यूज करते हैं, क्यों कौन सा डिसीज में हम लोग ये यूज करते हैं, वेंट्रिकुलर फिब्रिलेशन, पल्सलेस वेंट्रिकुलर टैकीकार्डिया एंड सडन कार्डियक अरेस्ट. तो पेशेंट को सडन कार्डियक अरेस्ट हो गया तो हम लोग ये यूज करते हैं. अदर देन दैट 2 इंपॉर्टेंट डिसीज कंडीशन, दैट इज वेंट्रिकुलर फिब्रिलेशन पेशेंट और पल्सलेस वेंट्रिकुलर टैकीकार्डिया पेशेंट्स. So ये दोनों कैटेगरी आ जाते हैं अरिथमिया. सो अरिथमिया इज नथिंग बट अ कंडीशन ऑफ हार्ट्स अफेक्टिंग इरेगुलर हार्ट बीट. सो इट्स कंडीशन, सो ये दोनों कंडीशंस अरिथमिया से, और ये दोनों अरिथमिया ट्रीट करने के लिए और सडन कार्डियक अरेस्ट ट्रीटमेंट करने के लिए हम लोग यूज करते हैं डिफिब्रिलेटर. So what are the complications of defibrillator? It is skin burn. So using a shock, we are giving a power and shock. So there is a chance the chest area there will be skin burns. And cardiac arrhythmiasis. So it also induce cardiac arrhythmiasis. Maybe क्या हो जाते हैं, सादा पावर के और सादा शॉक की वजह से दूसरा अरिथमियासिस डेवलप हो जाते हैं. दैट इज व्हाट कॉल्ड कार्डियक अरिथमियासिस. चेस्ट पेन, सो शॉक हम लोग शॉक डायरेक्टली चेस्ट में देते हैं. सो चेस्ट पेन ऑब्वियसली दैट पेशेंट को कॉम्प्लिकेशन में आ जाते हैं रेस्पिरेटरी अरेस्ट. ज्यादा फोर्स दिया तो इट इज अफेक्टिंग द लंग्स कोलैप्स हो जाते हैं, लंग इंजरी हो जाते हैं एंड इट विल कॉज रेस्पिरेटरी अरेस्ट. So these are the complications of using defibrillators. So it's important, actually this is important guys, so listen. Yes. Coming to another important questions in the med search 2 is disaster management. So what is disaster? What is the management? So disaster का definition क्या है? Disaster is defined as any occurrence that causing damage. So any incident, को एक incident हो गया तो that incident will cause damage. Ecological disruption, हमारे environment को disrupt करते हैं और loss of human life. ह्यूमन लाइफ का लॉस एंड डिटीरिएशन ऑफ हेल्थ एंड हेल्थ सर्विसेज, हॉस्पिटल और हॉस्पिटल सर्विसेज, हेल्थ सर्विसेज को अफेक्ट करते हैं ऑन ए स्केल। कैसे अफेक्ट करते हैं? दैट वी आर नीड टू टेक द असिस्टेंस फ्रॉम अनदर कम्युनिटी और अनदर एरिया। सो हम लोगों का एरिया में एक डिजास्टर हो गया तो हम लोगों को दूसरा लोग का मदद लेने हैं उस तक, दैट इज द स्केल वी आर असेसिंग डिजास्टर. So that is what called disaster. It's defined by World Health Organization as the occurrence of any damage, ecological disruption, loss of human lives, deterioration of health and health services on a scale sufficient to warrant an extraordinary response from outside the affected community. So outside the affected community हम लोग को help लेना पड़ेगा. That is what called disaster. So it is mainly two types, natural disasters and man-made disasters. So example of natural disasters क्या है? Tsunami, earthquake, flood, drought, that is hurricanes, that is volcano eruptions, that are coming under natural disasters. Coming to man-made disasters like motor vehicle accidents, road accidents, bomb accidents, military forces, that is terrorism, that kind of things, that is coming under man-made. So triage, color codes and their meaning. So coming to another important question, that is triage. What is triage? Priority. Giving. Triage is the classification of priority. So based on the patient's condition, we are categorizing the patient for treatment. That is what called triage. So triage is coming. First one is description. It is red. Red color is immediate and that is in the color red. So red color, if it is indicating that the patient need immediate care. Red is indicating क्या है? Immediate care. So patient को इमीडिएट केयर देना है. कमिंग टू येलो, अर्जेंट. वो इमीडिएट नहीं है बट अर्जेंटली वो पेशेंट को भी हम लोग ट्रीटमेंट देना है. दैट इज कमिंग अंडर येलो. कमिंग टू ग्रीन, डिलेड. सो दे हैव माइनर इंजरी लाइक अ स्मॉल हैंड इंजरी. सो उसको एक हैंड में थोड़ा इंजरी है तो उसको वेट कर सकते हैं, डिले कर सकते हैं ट्रीटमेंट, तो कोई प्रॉब्लम नहीं होता. No, sorry, there is no problem. So that is what called green. And dead, the patient already died. So that is coming under the category dead, black. So these are the color combination or color code of triage. What are the color? Red is immediate, yellow is urgent, and green is delayed, and fourth one is black, that is dead. So these are the classification. So coming to management, disaster management cycle. So what is the disaster management cycle here? It is very important. Mitigation is occurrence. So we are preventing the occurrence of a disaster. So disaster आने के पहले हम लोग उसको निकालने के लिए और उसको स्टॉप करने के लिए थोड़ा मेजर्स लेते हैं, वो प्रोसेस है मिटिगेशन. सो mitigation is the process where we are preventing the occurrence of a disaster. That is what called mitigation. Second one is preparedness. What is preparedness? We are preparing ourselves personally, professionally, community wise, how to cope up with the situation. So कैसे situation को संभालना है, हम लोग कैसे करेगा, प्रिपेयर करके. So एक डिसास्टर को कैसे मैनेज करेगा वो ही इधर प्रिपेयर्डनेस. रेस्पॉन्स. So third category is response. कैसे response करेगा, कैसे manage करेगा. And fourth one is recovery. So recovering the persons from the area and supporting in their system. So we are coming back to the normal life and again prevention. So again preventing the reoccurrence of the disaster. So this is the basically a disaster management cycle. Mitigation, preparedness, response, recovery and prevention. Coming to another important question that we are going to discuss is leukemia. What is leukemia? It is nothing but the blood cancer. So it's a type of blood cancer that affects bone marrow and blood forming tissues. Where it is affecting? It is affecting the bone marrow and blood forming tissues, leading to abnormal uncontrolled production of white blood cells in the body. So that person will develop abnormal production, white blood cells ज़्यादा product हो जाते हैं body में. So leukemia एक type of blood cancer affecting bone marrow and blood forming tissue. So it is leading to abnormal uncontrolled production of white blood cells. So WBC का amount ज़्यादा हो जाते हैं, abnormal amount, normal one नहीं, abnormal production of WBCs in the blood. That condition is known as leukemia. And what are the types of leukemia? Acute lymphoblastic leukemia, acute myeloid leukemia, chronic lymphocytic leukemia, chronic myeloid leukemia. So these are the main four types of leukemia. एंड ट्रीटमेंट एंड मैनेजमेंट. सो कैंसर कैसे ट्रीट करना है? कैंसर का ट्रीटमेंट क्या है? हियर कीमोथेरापी, टारगेटेड थेरापी, रेडिएशन थेरापी, बोन मैरो ट्रांसप्लांट, immunotherapy. So these are the main treatment protocols for cancer. So here bone marrow therapy is important. Why? Because it's leukemia. So coming to, if you are getting a cancer, breast cancer, example, you are getting the question of breast cancer. How you will write the definition? Breast cancer is nothing but abnormal tissue growth in the breast. That is simple. So this definition is how you are writing. If it is lung cancer, आपको lung cancer exam में लिखना है. कैसे definition लिखेगा? Lung cancer is nothing but the abnormal growth of cells in the or tissues in the lungs. Yes, definition. Same only definition. So what are the signs and symptoms will be coming? So after cancer, what are the signs and symptoms will be coming? That if it is a breast cancer, there will be breast enlargement, breast swelling, color changes will be there in the skin, and the milk production will be increased, or fluid or any leakage of fluids from the breast or nipples. ऐसे. And the treatment way, कैसे treatment of कैंसर का ट्रीटमेंट कॉमन है. कैसे करना है? थेरापीज, कीमोथेरापी, टारगेटेड थेरापी, रेडिएशन थेरापी, बोन मैरो ट्रांसप्लांट एंड इम्यूनोथेरापी. So these are the main treatment for every cancer. So you can write this treatment for every cancer. So all cancer treatment is same है. और क्वेश्चन क्या है? क्वेश्चन that is also important. What is question? That is also you need to study. So a change in bowel or bladder habits, a sore that does not heal, unusual bleeding and T4 thickness or lump in the dust, I for indigestion, O for obvious change in water hormones, N for nagging, F for harassness. Study well about caution also. Caution is the warning sign of cancer. So what is caution? C stands for change in bowel or bladder habit. A for a sore that does not heal. So like a sore will be there but that's not healing. And U for unusual bleeding from the body or discharge. T for thickening or lump in the breast or elsewhere, anywhere in the body. And I for indigestion. O for obvious change in water hormone. N for nagging, cough for harassness, change in sound. This is warning sign of caution. Or it is known as warning sign of cancer. It is known as caution. So next important question, that is burns. Yes, it is also one of the longest question. Burn is a skin or tissue injury caused by heat, chemicals, electricity or radiation leading to cell damage, fluid loss and infection risk. So what are the types here? Based on the depth, it is divided into 4 main types. First degree burns, like superficially the skin will be affected. Second degree burns, third degree burns and fourth degree burns. So this is a burns is nothing but due to a heat or chemical, electricity or radiation, the person will get burns or injuries or So a burn is a skin injury or tissue injury caused by heat, excessive heat, chemical, electricity or radiation leading to cell damage, fluid loss and infection risk. So types, based on the depth, it is divided into first degree, second degree, third degree and fourth degree burns. So what are the management for burns? It is airway protection to ensure the airway patency. So we need to make sure ABC. What is ABC? Airway, breathing and circulation. So we need to check for ABC, maintain ABC, airway, proper airway, breathing and circulation, fluid resuscitation. So the body will lose after burns. क्या हो जाते हैं? body को fluid leakage हो जाते हैं, fluid dehydration हो जाते हैं. So we need to replace. So using the formulas, we need to replace the fluid. So IV administration of fluids is very important. And pain management, because they have pains. Burns is causing skin injuries, so there will be huge pain. So manage with the pain, infection control. So skin को affect हो जाते हैं, so complication में skin infection होने के chances है. So control the skin infection and wound care. So wound care also be controlled. So these are the nursing management of burns. Coming to, we will discuss about rule of 9. So what is rule of 9? To assess the burn percentage, how much हमारा बॉडी में एक बर्न हो गया तो उतना परसेंटेज बर्न हो गया, स्किन का परसेंटेज कैलकुलेट करते हैं रूल ऑफ 9 के बेसिस पे. क्या है रूल ऑफ 9? हेड पे इंजरी हो गया तो फ्रंट और बैक साइड में हेड पे इंजरी हो गया तो 4.5%, बॉडी को इंजरी फॉर द अपर बॉडी फुल इंजरी हो गया तो 18%, एंड द बैक साइड आल्सो इट इज 18%. बोथ द हैंड्स कैरी 4.5% in the both upper and lower parts, like both in the top and bottom, and in the legs it is 9%, in the extremities it is 9%. So this is the calculation. In 100% we will calculate how much total body surface area is burnt. TBSA, total body surface area is burnt. So this is rule of 9. Rule of 9 is percentage of body surface area burned. We will calculate through rule of 9. So coming to another important question is Parkland formula for burns. What is the Parkland formula? 4 ml into body weight into kg into total body percentage of surface area burned is equal to total volume. So how we are administering fluid? So we will give IV fluids. How we will administer it is, we will calculate 4 ml into kg body weight. Example 45 kg into what is the percentage? 30% body. So the answer will be, I am very bad at maths guys, don't worry. So the answer will be the amount of fluids that given to that patient in 24 hours. This is the formula of calculation of burns. I am little bit bad at maths. Yeah. Yes. Coming to another important question, myocardial infarction. So what is myocardial infarction? It is nothing but heart attack. What it is? So let's discuss about myocardial infarction. It's the irreversible damage of death of heart tissue. So heart muscles, the damage or death of heart muscles due to sudden blockage in the blood flow to heart. Heart का muscle में blood flow का reduction हो जाते हैं तो क्या हो जाते हैं? It is irreversible damage. Excuse me. Sorry. So myocardial infarction is irreversible damage. So it is irreversible. Why? Means we can't reverse the symptoms. It is a irreversible damage or death of heart muscle tissue due to sudden blockage of blood flow to the heart, usually caused by blood clot in the coronary artery. So any block in the blood clot, any in the coronary artery, if any block is there, that will lead to insufficient supply of blood to heart muscles. Then it is known as myocardial infarction, also known as heart attack. So what is the causes of myocardial infarction? Coronary artery disease, blood clots that forms in the anywhere in the artery, and coronary artery spasm, hypertension, high cholesterol, smoking, diabetes, obesity, stress, and sedentary lifestyle, lack of physical exercises, and the food habits of that person also influence in myocardial infarction. So these are the main causes of myocardial infarction. So what is the management here? As a medical management, we need to give oxygen therapy to support the oxygen to the heart muscles. Oxygen therapy, pain relief, antiplatelet therapy, anticoagulation, beta blockers, nitrates, ACE inhibitors, and statins, thrombolytic therapy. So these are the main medical management in the case of myocardial infarction. So heart attack कैसे treat करना है? ऑक्सीजन थेरेपी देना है, पेन रिलीफ, चेस्ट पेन है, चेस्ट डिस्कम्फर्ट के लिए पेन रिलीफ, एंटीप्लेटलेट थेरेपी, एंटीकोएगुलेंट्स, बीटा ब्लॉकर्स, नाइट्रेट्स, ACE inhibitors, statins, and also thrombolytic therapy. So these are the main medical management. Coming to surgical management, that also is important in myocardial infarction. Why? Because it is a 10-mark question. So what is the surgical management? Percutaneous coronary intervention. So also known as angioplasty. हम लोग last class में discuss किया है. In the case management of angina pectoris, we have already discussed about percutaneous coronary intervention. Coronary arteries bypass graft surgery, also known as bypass surgery. So it is mainly known as bypass surgery. And implantable cardioverter defibrillator, left ventricular assist devices. So these are the main surgical management or intervention in treating myocardial infarction. Another important disease condition that we will discuss in this section is acute immunodeficiency syndrome or AIDS. It is caused by human immunodeficiency virus. So it's a life-threatening condition. So causes, क्या इधर causes? causes है human immunodeficiency virus. So which weakens the immune system by destroying the CD4 T helper cell. So हम HIV infection हो गया तो क्या हो जाते immune system को अटैक करेगा. So the human body का immune system को अटैक करके destroying CD4 और T helper cell को destroy करेगा. So it's a immune system disorder making the body vulnerable to infection and disease. So it will decrease the immunocompromised state of that individual. So individual का immunity power less हो जाएगा, बाद में infection और disease conditions easily आ जाएगा. So that condition is called AIDS. It's a life-threatening disease condition caused by human immunodeficiency virus. So कैसे ट्रांसमिट हो जाते हैं फ्रॉम वन पर्सन टू अनदर पर्सन? इट इज थ्रू अनप्रोटेक्टेड सेक्सुअल इंटरकोर्स, ब्लड ट्रांसफ्यूजन और रिसीविंग अ ब्लड विद HIV. सो ब्लड ट्रांसफ्यूजन करने के टाइम ब्लड कंटामिनेटेड HIV से कंटामिनेटेड हो गया तो दैट नेक्स्ट पर्सन विल गेट आल्सो इन्फेक्शन. एंड शेयरिंग नीडल्स और syringes in drug abusers cases, though they'll share the needles to use the drugs, so inducing the drugs. That is also mother to child during the pregnancy. So mother को HIV है तो वो बच्चे को ड्यूरिंग द प्रेगनेंसी एंड डिलीवरी टाइम बच्चे को भी HIV और AIDS का इन्फेक्शन हो जाते हैं. ऑक्यूपेशनल एक्सपोजर, सो दैट इज विल बी सीन इन नर्सेस. सो इंजेक्शन देने के टाइम नीडल स्टिक इंजुरीज और नीडल प्रिक इंजुरीज, मिस्टेकनली नीडल प्रिक हो गया तो इन्फेक्शन होने के चांसेस है. सो दिस आर द वे और मोड ऑफ ट्रांसमिशन ऑफ HIV और AIDS. So coming to clinical manifestations of AIDS. AIDS का clinical manifestation है. First is early symptoms. So fever, night sweat. So early पहले क्या हो जाते हैं? Fever, night sweats हो जाते हैं. Fatigue, weakness, swollen lymph nodes. So in the entire body lymph nodes को edema swollen हो जाते हैं. And weight loss, persistent diarrhea. Continuously that person को diarrhea हो जाते हैं. So these are the early signs and symptoms. Coming to advanced symptoms. So what are the opportunistic infection that person will get? So because of decreased immunity. Because of decreased immunity, that person will get advanced symptoms like tuberculosis, pneumocystitis, pneumonia, gastrointestinal disease like chronic diarrhea, oral thrush. Oral thrush means the infection in oral, candidiasis. So infection will be inside the mouth. And neurological issues like memory loss, confusion, HIV, encephalopathy, skin disorders like Kaposi sarcoma and herpes zoster. So these are the advanced symptoms of HIV. Why? Because loss of immunity or immunocompromised state, less immunity power के वजह से और early symptoms और advanced symptoms हो जाते हैं. So they are more prone to get the infections compared to a normal person. Coming to management of AIDS. So कैसे manage कर सकते हैं? Antiretroviral therapy. So it is a virus, human immunodeficiency virus. So what virus for that? क्या हम लोग यूज करेगा? Antiretroviral therapy, opportunistic infection treatment, supportive care, regular monitoring and palliative care. So it is we don't have a cure for AIDS. AIDS को एक cure नहीं है, proper treatment नहीं है, इसलिए palliative care also is necessary. Another important question that we will discuss is otitis media. It is nothing but a middle ear infection. So it is the infection of middle ear. That condition is known as otitis media. So what is the definition? Infection ear middle ear का infection हो गया तो वो बोलते हैं otitis media. It's caused by bacteria or virus leading to fluid buildup behind the eardrum. So in the behind the eardrums there will be fluid filled up. So there will be abnormal fluid buildup inside the middle ear. That is what called it is the infection of middle ear is called otitis media. So otitis media का definition क्या है? Inflammation or infection of middle ear. So it is divided into mainly three types: acute otitis media with effusion, and chronic otitis media. So that's the three types, mainly three types. That is acute otitis media with effusion, and chronic otitis media. Another important question, anemia. So what is anemia? It's a condition which blood has lower than normal blood number of red blood cells. So there is a decreased RBCs, then it is known as anemia. Hemoglobin leading to reduced oxygen delivery to tissue. So lack of proper RBC and HB, hemoglobin, then what will happen? There is lack of oxygen supply to the tissues of the body, then that condition is termed as anemia. So anemia क्या मतलब क्या है? It's a blood has lower than normal number of red blood cells or hemoglobin, leading to reduced oxygen delivery to tissues and organs. So what are the main types of anemia? Iron deficiency anemia, vitamin B12 deficiency anemia, folate deficiency anemia, hemolytic anemia, aplastic anemia, sickle cell anemia, and thalassemia or chronic disease anemia. So it is has so many variety of types. Iron deficiency anemia, vitamin B12 deficiency anemia, folate deficiency anemia, hemolytic anemia, aplastic anemia, sickle cell anemia, thalassemia, and chronic disease anemia. So these are the main types of anemia where there will be lower than normal number of RBCs and hemoglobin. So here itself we can see in normal this is the blood, and here in anemia condition there is lack of or reduced number of RBCs and hemoglobin will be present. Next important question is amputation. This is also a previous year question paper. I saw this question, so you need to study. This also may come for a next exam. So amputation is the surgical removal of limb or a part of limb due to injury, disease or infection. It is nothing but cutting a part of a body, cutting a part of body due to infection or injuries. That is what called amputation. So what are the purpose here? To remove the malignant tumor. Sometimes there will be tumor inside that body. So to remove the tumors, we will do amputation to prevent further infection, to relieve pain, to correct severe trauma, and to improve the function. So in case of diabetes mellitus and all, some patients they'll go for amputation process. So this is where we are surgically removing a part of a limb. That is what called amputation, and that's the definition. So pre-operative and post-operative care. So assess the physical and emotional health of the individual. Patient education is necessary. Prepare the limb, and pain management and support care is important before the operation. And coming to post-operative care. So what are the measures you need here? Pain management, wound care, monitor for complications to prevent further infections. We need to monitor position and limb care and rehabilitation and processes training. So after the cutting of a limb, one of their body part is removed. So we need to give them a rehabilitation and provide prosthetic services. So coming to some meanings. What is alopecia? So alopecia is a partial or complete loss of hair from the scalp or other parts of the body. So alopecia is a side effect of cancer treatment. It's a side effect of chemotherapy. So what is alopecia? Hair loss. It is a complete or partial hair loss. It's a complication or a side effect of chemotherapy. Cyanosis. क्या है cyanosis? It's a bluish discoloration of the skin or mucous membrane due to inadequate oxygen level in the blood. So ब्लड में ऑक्सीजन लेवल का कम हो जाते हैं तो बाद में क्या हो जाते हैं? बॉडी का ब्लूइश डिस्कलरेशन. सो ड्यू टू ऑक्सीजन लेवल इन डिक्रीज्ड ऑक्सीजन लेवल इन द ब्लड. सो ब्लड में ऑक्सीजन का लेवल कम हो जाते हैं तो क्या हो जाते हैं? साइनोसिस, ब्लूइश डिस्कलरेशन ऑफ स्किन. Next important question is that is lordosis. It's an abnormal inward curvature of spine typically in the lower back. So in the lower back, the curvature. So there will be a abnormal curve. So that person's body will have a abnormal curve. That is what called lordosis. And the next one is scabies. It is a skin infection caused by microscopic mites leading to intense itching and rash. So it's a type of skin disorder, that is scabies. Chemotherapy. What is chemotherapy? It's a treatment that uses drugs to destroy or control the growth of cancer cells. So example, cisplatin, vinplastin. So these are the main two examples of drugs that used in chemotherapy to treat the cancer. So chemotherapy is particularly treatment using drugs to destroy or control the growth of abnormal cancer cells. Acne vulgaris. So acne vulgaris is a common skin condition characterized by pimples, blackheads and cysts primarily affecting the face, chest and back. So it's one of the skin disorders. So it's characterized by pimples. So if you are getting pimples, that is from acne vulgaris. So what is acne vulgaris? It's a common skin condition characterized by pimples, blackheads and cysts primarily affecting the face and chest and back. Stye. A sty is a painful red bump on eyelid causes an infected oil gland. So it is mainly used, so you can see in eyelids. So infection due to oil glands, it's a painful red bump. Arrhythmias already discussed. It is a irregular heartbeat. Yes. So we have discussed most of the important questions from both the subject Message 1 and Message 2. I hope everyone understood. किसी को कुछ डाउट है तो अभी पूछ सकते हैं, मैं वो डाउट का आंसर दे सकते हैं अभी. तो कुछ डाउट्स है तो प्लीज पूछ सकते हैं. Yes, so we are coming to an end. So thank you everyone for watching the videos. So study well and be prepared for your exam. All the best for your exams. We will meet in the next sections with another topics. Till that, thank you. So take care.